Hello, my name is Daniel Trujillo, and this is my health insurance activity assignment. So, starting off with the first part of the assignment, I chose to make a completely new health insurance plan since I wasn't really familiar with my own, and my parents aren't really too familiar with the information on it. So, for the created one that I made, I chose my standard demographics, like I'm a Hispanic, 21-year-old male, and I specifically said that I'm in a one person household. And the plan that I chose is known as the Anthem Silver Essential 7000. And for this plan, the deductible is $7,000 with the maximum out of pocket for per year being $7,800. And this is covered through Medicaid, which it's specified on the website. And this one specifically has a 50% coinsurance after deductible, which and this plan only covers generic drugs and no name brand drugs. And for the co-payments, it all varies through different categories such as emergency, patient care, urgent care, and a specialist care. And for emergency room, obviously being the highest one, it has a $500 copay after the deductible. And the other three, such as primary, specialist, and urgent care, vary from $25 to $75 per before first visit, and then after that, it's a different price, all depending on where exactly you're at, I'm assuming. And I specified that I'd have medium use in my health insurance plan, which totaled up the yearly cost to about $4,200 per year. So for the second part of my assignment, I chose for my procedure, I chose veneers, which is a dental care procedure. And I specifically chose the one that has resin material placed over the teeth, and it's fabricated there on the spot while you're sitting down in the chair. So for the cost on this one, I looked it up. I was actually surprised it wasn't a lot more because I've always heard of veneers being like a really expensive procedure that a lot of people have gotten recently, especially now in the last few years. For the out of network cost or the uninsured cost, it would be just over $800 at $868, and for the in network service, it would be just over $500 at $568. So having that insurance covers just over half of it, I'd say, a little over half. And then some of the uses for both of these websites that you can make like healthcare plans for or figure out what procedures costs is that you have a lot of different sources at your disposal in one website which you provided. And if you're ever planning to, let's say, get a procedure in the future, you have an idea of how much the cost would be depending on whether your service is in network or out of. And it's also a great tool for future planning. Obviously, I'm graduating soon, so a lot of students who graduate have to usually live on their own, or a lot of them go back with their parents, but a lot of people do prefer to live on their own afterwards. And that's something I plan on doing. So I definitely want to figure out how much or what kind of plan I would need to be better off on my own and still have good healthcare resources, and figure out how much the cost for that would be. And so I think this is a great website for pulling all that data together to better plan, at least financially, what your plans would be healthcare wise. So I find it to be a really useful thing to have. That's all. Thank you.